Hi, my name is Fatima Romo and I'm going to talk about Myxoma atrial. Definition. Myxoma is a benign tumor attached to the endocardium that does not infiltrate adjacent tissue. It can originate in every heart chamber. However, the most common location is in the atria, especially the left by 80%, the oval pit of the atrial septum being the most frequently affected area.
Today's topic is myxoma. It is an uncommon intracardiac tumor, or a tumor that is present inside the heart. The left atrial myxoma constitutes 75% of all the occurring myxomas, while the right atrial myxoma represents the remaining 25%. Such new growth of tissue is usually a soft, irregular shaped jelly-like accumulation, or a round, firm gathering of mass. These tumors are linked with endocardium, the inner lining of the cardiac. The cells which comprise of the myxoma tumor are spindle-shaped and are rooted in an environment made up of mucopolysaccharides. Such abnormal growth of tissues is also termed as atrial myxoma. Causes. Myxoma tumors do not arise due to any causative agents. Myxoma tumors are the result of multipotential mesenchymal cells and may lead to a ball valve-type barrier. Almost 10% of such patients acquire such tumors due to hereditary reasons.
Applications in medicine. Myxomas represent 0.25% of all heart disease, even if their annual incidence rarely exceeds 0.5 to 1 individual case per million. Myxomas are the most frequent primary cardiac tumor in adults. The atrial myxoma can be divided into primary and secondary. The primary is pediculate and secondary is sessile.
Sessile or pedunculated. Sessile means that they will be fully attached to atrial septum and will be immobile, while pedunculated means that they will be hanging from interatrial septum through a stalk. Thirdly, there will be soft villous lesions, which means that they will have villi or finger-like projections, as you can see here in this diagram. And then they may have gelatinous appearance. And lastly, pedunculated masses often grow downward and cause obstruction of atrioventricular valve. This phenomenon is known as wrecking ball effect. So overall, grossly, you will see that myxomas arise from interatrial septum. They may be sessile or pedunculated. They are soft villous lesions with villi, and they may be obstructing the AV valves. For microscopic features, the keywords to remember are myxoma cells and myxoma matrix. First keyword is myxoma cells, which are star-shaped or stellate cells with multiple nuclei, as you can see here in this diagram. And these myxoma cells will also admixed with many undifferentiated cells. Myxoid matrix means mucoid matrix that is made of mucopolysaccharide ground appearing as blue homogeneous background.
Pros and cons. Pros. Within benign CT, myxomas are characterized by the most constitutional symptoms. Atrial myxomas are not common in infant and child patients. The presence of a right atrial myxoma is rare and only 1/5 of tumors will appear in this location. Cons. The brain is the main place to which they are embolized and by 40% involves the two hemispheres. It has been associated with analytic, immunologic, and markers of inflammation. Metastatic disease is always by definition indicative of malignant primary heart disease. issue applied in Ecuador. In Ecuador, by sex and age-related demographics, approximately 75% of sporadic myxomas occurs in women. Surgical treatment is the only solution, and the best way to diagnose it is with an echocardiogram. In a retrospective analysis of 367 patients, 28 cases of right atrial myxoma, of which 16 were male and 12 were female. Also, myxomas that appear on the left side can cause thrombus.
Tumor which is much less common than the secondary cardiac tumors. Echocardiogram demonstrates left atrial myxoma very well. Left atrial myxoma is seen on echocardiogram as a mass. It is seen moving towards the left ventricle from left atrium in diastole in the right panel. The site of attachment of the myxoma is not evident in this view. A four-chamber view had shown that it is attached to the interatrial septum with a stalk. Please subscribe to this channel for future updates. Click on the subscribe button. Press the bell icon after that for all updates. Right atrial myxomas are rare. Percutaneous ablation and retrieval of a right atrial myxoma has been reported, though usual approach for removal of myxomas is open surgery. Rarely, myxomas can occur in the right ventricle and the left ventricle.
Conclusion: heart tumors are rare with very low prevalence. This tumor may have a sporadic or familiar presentation with autosomal dominant inheritance, known as Carney syndrome. Its diagnosis is made by echocardiogram plus confirmatory histology. Its treatment is always surgical with a good prognosis and low rate of recurrence.
44 years old. I've lived here in Wisconsin for 18 years. Kids went to Hershey Park last June of 2011, and I came back and I had this condition on both of my feet. I assumed it was some kind of athlete's foot that I had picked up from walking barefoot in the park, and I tried every over-the-counter medication that I could get my hands on to treat it myself. Until one night it got very, very bad. The blisters were just multiplying. I said, I just cannot go another night like this. I went to the ER, and that's when I was misdiagnosed, and they decided to put me on a sulfur-based antibiotic, under the assumption that it was a staph infection that I had actually gotten. The myxoma, the tumor, had actually started to break away from my heart, and what was causing the blisters was actually parts of the tumor that they call embolisms, disbanding itself, getting ready to break away from the heart entirely. And I was actually told that once that happened, I would have 20 minutes to live.
¿Qué onda, Luis? ¿Qué haces? Aquí nomás trabajando en el corazón y estudiando myxomas cardíacos. ¿Qué son myxomas cardíacos? Cardiac myxomas make up 30% of all atrial tumors. Cardiac myxomas are classified as one of the types of rare atrial tumors in the heart. What are the symptoms? The symptoms are palpitations, chest pain, and also apnea. Is it preventable? No, it's a tumor. Did you read that paper on cardiac myxomas and its manifestation on the central nervous system? ¿De qué hablas? Well, the central nervous system is composed of several elements, and the central nervous system splits into 6 branches, which is the central nervous system and the peripheral nervous system. And the peripheral nervous system breaks up into the autonomic and somatic nervous system, and the autonomic nervous system breaks into the parasympathetic and the sympathetic nervous system. And all these work together to relay messages from the outside world into the body, as long as with internal components, and maintain homeostasis. Well, what does this have to do with cardiac myxomas? Well, I mean, there has been several cases in other parts of the world where children and middle-aged men and also even older men have been getting central nervous system symptoms like hemiplegia, microbleeds. Sometimes it could be quadriplegia. So all these myxomas are having an effect on the CNS, and doctors can't find out why.
Thank you.